I was the planner and organiser, we were thinking, well, we'll be lucky if we get 15 or 20,000. And then they came, not just from Stafford, from all the surrounding villages, from all the local towns. And they came in buses, in minibuses. We had old age pensioners coming in proper minibuses as well, disability scooters, everything came that day. And I just was very proud of everybody there, and it was equally very humbling. Because when you looked at everybody, it actually represented, as you're saying here, a lot of very similar to some of the issues we've got. And you would have the young, people pushing pushchairs. We did have a lot of teenagers, so that was really good in that way as well. We had people on mobility scooters, people in wheelchairs. My sister was among the crowds. She was walking with an 85-year-old man who was determined, whatever, to walk that mile, even though he was breathless. They were going to do it for their hospital. Yes, we've had a bad press, and this is 7 years ago. You never judge a book by its cover, because there are issues in how that came about. But yes, we admit there was some bad behaviour, there was not good practice at Stafford, but it's made inroads to being one of the top 20 hospitals in safety in the UK. But what happens? Suddenly we are going into administration after a report. And what really sickens me is that we have people from Ernst & Young, accountants, coming in through Monitor, pay God knows how much, to actually come and do a report. Now they said they would consult. It reminds me of what you were saying. There is no transparency. Consultation is not a proper consultation. You get about it a day or two before. The public don't know, they're not properly consulted about decisions that affect their lives. So basically, with the other interesting thing, and I'm going to tell you this because you know that we've gone into administration. They came in last week. What absolutely shocked me was I saw some of the same people in that report that are coming for the initial project to look at the feasibility of Stafford. The same people came as administrators, which actually really shakes of bad practice, because really they should be looking at it anew as to what happens to our hospital. We are on the same page here. We're fighting for A&E. It was reduced. But as soon as you start losing your A&E, I started with, I'm a co-founder of the Support Stafford Hospital Group. We started 2 years ago when they were looking at downgrading the A&E. And we were trying to warn the public that, look, if this begins to go, you're going to lose your other essential services. It's actually happened, and I love the coffee because that's what's going to happen. But basically, we're fighting now very much for our key essential services. We're fighting maternity. The outlying hospitals, capacity is still a problem. A&E gets closed, so you have to go to the nearest hospital, which could be a big distance away. I'm just going to tell you one quick story about a gentleman. He was an elderly, a gentleman in his elderly 60s, whose wife had a heart attack. Now normally she would go to Stafford, which actually has a very good rate of treatment performance for heart attacks. But no, she couldn't because it was past 10 o'clock. So she went to go up to Stoke. Now Stoke is about 15-20 miles away. That was closed. Then Wolverhampton, which was our next nearest super duper hospital, and that was shut. So all 11 hospitals nearby were closed. They ended up, for anyone that knows the geography of England, get down what is a 1 hour, 4-minute journey to Hereford Hospital. Hereford did everything they could to save her, but she died. When he eventually got home 2 weeks later, he got a bill for £250 for the journey. We are having horror, it is putting our lives at risk. We are on the same page. I suggested the demonstration. I'm a bit of the rebel in the group, I'll admit it, because I believe not in politics, we're apolitical. I don't trust anyone. The people I trust are the people. And I think we have to vote with our feet. That's the reason I wanted to come down and meet with you. It was a surprise trip over. I saw you got a public meeting. I couldn't resist. I had to come over. Was actually that I want to be able, us to unite. I know you've got the Hockley one for London, but I'm going to suggest, and I'm very interested, we get one that's national. Let's ring-fence everything and really put a stop to it.